Good morning, everyone, and thank you guys for joining us today. Um, I understand that you could have been doing a million other things today, and yet you chose to be here with us. So, for that, we are appreciative of your time and we welcome you today. My name is Will Safotu. I am a school counselor with the Family Resource Centers. I am joined here today with my esteemed colleagues, school counselor Kim Yeremia and school psychologist Roxy Carboni. We also have the pleasure today to introduce to you our guest speaker for today, a good friend of ours, Julie Turvey from ChildNet Services. Thank you, Julie. Quick housekeeping notes. If you guys are trying to unmute yourselves or trying to turn on your cameras, unfortunately, I turned that off. Um, we are recording this session today just so we can share this in the future with any of our friends that might not have been able to join us today. The main form of communication for our session today will be the chat. So please, if you have any questions, feel free to type it in the chat and we will do our best to get to you. Also, there will be a couple polls that Julie will be asking during her presentation. We highly encourage you to participate as well. Lastly, there will be a survey that we will post in the chat, a link for today's services, just to help us understand how we can better help you. Please be sure that you do that as well. I know I said lastly, I lied, I'm sorry. Um, Wanted to give you guys a heads up that this is the first in a three-part series. We do have two more workshops after this. One in February, it's titled Understanding Depression in Children and Teens. That will be Tuesday, February 16th. And then the third installment will be Understanding Anger and How to Manage It. And that will be March 16th on a Tuesday as well. The Zoom links will be updated if you haven't done so already. Please follow us on Instagram at LBUSDFRC and on Twitter as well. Kim, if you wouldn't mind posting those usernames in the chat. And without further ado, Julie, the floor is yours.
All right, thank you, Will, and thank you, Long Beach Unified, for everything for partnering today. And welcome, everyone. We are so glad that you're here. I'm going to go ahead and share my screen here. And hopefully, can you all see that okay? Yes, thumbs up. Okay, awesome. Again, thank you, Will, and to Long Beach Unified and our Family Resource Centers for partnering. And we just thank you so much for scheduling this. My name is Julie Turvey, and I'm a licensed MFT. I work at ChildNet Youth and Family Services in Long Beach, and we are a nonprofit, and we provide free counseling for children ages 0 to 18 that have Medi-Cal insurance. So I've been with ChildNet for 17 years. I started as a social worker in our foster care division, and then did therapy for many years with families, and now work in our outreach and community division. So as Will said, I know all of you are really busy, and we just thank you so much for taking the time to be here today. As the many years that I've done therapy with families, I started to notice that parents were doing the best they could and they love their children a lot. And sometimes there are some simple tools and some education that can be helpful for them in order to be the best parent they can be. So that was why I started to get passionate about parent workshops and parent education, because sometimes some little tweaks and tools can really make a big difference in your child's life. So thank you so much for taking the time to care about your children, or if you're a district counselor or administrator, that you're taking time to learn about these various disorders in children. So if you could, again, I know as Will was saying, unfortunately, the video and the sound is disabled, but if you could enter in the chat box, that would be wonderful. Your name, if you have children, how old they are, and how you heard about our workshop. It's wonderful to see where everyone's listening in from and to get to know you a little bit better. I also have two children. They're in their 20s now. They're both in college. So I forgot to say that earlier as far as introductions. So the topic today is anxiety. And it's kind of a lot of information that we're going to cover in about an hour. So the format is going to be a little bit, I'm going to go over it here, the objectives. We're going to start with all the different anxiety disorders, and then we will get to the parent piece and what we can do about that. So I'm going to go through the disorders a little bit quick because, I mean, we could spend an hour on each one, but in the interest of time, I want to do kind of a brief overview of the different disorders and then get to interventions that can be helpful. So after this training today, hopefully you'll be able to identify what are the primary anxiety disorders in children and teens. You're going to learn what's normal anxiety and what can be something that needs actual treatment. And also, what are some steps and linkages that you can do to help children that are struggling with anxiety? So our first question is, what is anxiety? When we hear that term, a lot of things might come to mind. And so I crafted a little poll here, and I'm going to launch this, see if this works. If you could answer what you think anxiety is, that would be great. The first one is it excessive intense fear? Is it worry thoughts about the future? Is it a fast heart rate and overwhelming sense of dread? Is it feeling overly tense for no reason that you can't explain? Or is it all of the above? So let's see. Looks like so far we have, you guys figured out our trick here. We have 18 people that answered all of the above. Yes, it is all of the above and then some. There's quite a few symptoms that go along with anxiety, but yes, all of those do fit in that criteria. So thank you. I may go ahead just in the interest of time end that polling, but I wanted to see what you guys thought about that. Thank you. So we all worry at times, right? And especially the times nowadays, we're in a pandemic, we're going through lots of changes, we're worried about our health. We may have family members that we're concerned about. We all do worry sometimes, and that's not a bad thing. That's normal. That's our brain protecting us from any kind of danger. So today we're going to learn a little more what's normal and what could be something to where we need a little extra help. So as we were talking about the different symptoms of anxiety, there is a lot of symptoms that go along with it, and they can correlate with other disorders as well. But it is an excessive and uncontrollable worry and fear. It can be very overwhelming for the individual when they're having it. And one myth that I want to dispel is that we have control over our worry. The way that our brain works is the amygdala part of our brain is the part of our brain that handles our fight or flight. And so the way that our wiring works is that our brain's job is to protect us. And so, for example, when a bus ran a red light and is coming towards us in the street, that amygdala steps in to protect us. And that's why we can jump out of the way of a moving bus without stopping to think, should I move right now? Should I not? Is it really going to hit me? Is it not? No, our brain is beautifully designed to protect us in that moment. And so that's why we can't really stop those worry thoughts because they just naturally happen from our amygdala. And unfortunately, the way it works is it only goes one way. So we can't just tell our amygdala to stop. It's just doing its job to protect us. And some of us worry more than others, whether it is a genetic trait, whether it's, just evolutionarily over time, different people worried more in societies. And that actually was an adaptive mechanism because they were thinking about how can we stay safe? How can we all stay alive? And unfortunately, though, sometimes our brains do it a little too much nowadays, and it causes us a lot of uncomfortableness and feelings that aren't good for us. So we're going to talk about that, but I first want to dispel that myth that we have control over that. It's actually our amygdala just doing what it's supposed to do. And if we can view it with a sense of without judgment, that it's not right or wrong, that it's okay to have a fear thought and that we can write above that when we need to, it really helps us to approach ourselves with a sense of compassion and without that judgment on ourselves or of other people, hopefully. So just some quick facts about anxiety disorders. It is the most prevalent mental health condition in children and adolescents. About 10 to 20% of children and teens do have this disorder. It can begin really early as I'm not sure why those scratches are happening. Sorry about that. It can begin really early as preschool, sometimes even younger. They even notice in infants, some infants appear more fearful than others. And so it's sometimes a result of their environment, but other times it might be a result of just their natural personality traits. It is more common in girls than boys. You can have an anxiety disorder along with other things like depression. So just because you have an anxiety disorder doesn't mean that you don't have other things. And it can be persistent if it's left untreated. So unfortunately, if we ignore it, it just doesn't go away. We do need to face it head on and think about treatment options and how we would like to get better. And there is a risk for these long-term consequences when it's left untreated. People can suffer for a really long time in their life. And that's why we are so excited about early intervention, why we want to educate you guys as parents, why we want to educate children so that they understand what this is and know that it's not their fault and there is help available. So the disorders we're talking about today, I want to start by saying that as much as I'm educating everybody, a true diagnosis, which is done from the DSM, which is the Diagnostic and Statistical Manual of Disorders, an actual diagnosis does need to be done by either a pediatrician, a physician, a psychologist, a licensed MFT or social worker, and also psychiatrists. So we're going to review a lot of disorders, but I don't want you to feel like, oh, I can diagnose everyone now. We do want that to be done by a trained professional. But also that knowledge is very helpful for all of you. So if you start seeing some of those symptoms, you're like, maybe I better get this looked into a little bit. All right, so before we go into any kind of disorder, let's talk about what are some common fears, because all children naturally, developmentally have fears, and that doesn't mean that they should have a diagnosis. So for toddlers, fears of imaginary creatures. I don't know if you can see in this picture here, this was actually a picture from one of our clinical supervisors at ChildNet. Her son, absolutely terrified of the Easter bunny there, which is completely normal. Toddlers should have a fear, or many have a fear of imaginary creatures. That's why, you know, I know when my child was 4 years old, we went to Goofy's Kitchen at down at Disneyland, and he was just terrified of all the creatures. It wasn't so fun. So now that I know what I know, maybe that wasn't the smartest move, but just don't feel bad if your child screams when Mickey Mouse or someone comes their way. That's perfectly normal. Fears of the darkness, fears of being apart from their parent is normal for a toddler. As a parent, you are their source of safety. So when you're gone, that can feel very stressful for them. And as they get older, they start to want more space from you, and that's also healthy. But just know that that can be really normal, especially in young children. When kids get to school age, they might have various types of worries about a lot of things in general. Once they're learning about the real world, worries about injury. Right now with the pandemic, they might be worried a little bit about that, rightly so. Natural events like storms or earthquakes, volcanoes, anything that they're learning about that could actually happen to someone, they might start getting worried about those types of things. And then for teens, there can be fears related to school, fears related to their social competence among their peers and their friends. We know for teens, a lot of times, you know, where they're standing in that group of their friends is very important to them. So any kind of evaluation by peers can feel pretty stressful for teens. And then also any kind of health issues. We know that teens are going through a lot of changes physically, developmentally, and hormonally. So that can also bring up some concerns for them. So these are common fears, not things that, you know, necessarily would be a diagnosis for a child. But unfortunately, left untreated, there can be some consequences of anxiety. If we're not helping them with this, they can have a lower self-esteem, those feelings of helplessness, having any kind of physical complaints, perhaps sometimes even delays in meeting developmental tasks. They might have problems in school because it's hard for them to concentrate because they're worrying so much. They might fall behind in class if they're not going to school. And some other types of consequences here, like social and family stress. It can definitely cause arguments in families when, there is a significant amount of anxiety because parents get frustrated. They're not sure why it's happening. So we do want to address it and not ignore when this is coming up for youth. I'm going to check the chat box really quick. Make sure. Okay, thank you everyone for signing in, letting us know where you're from. This is wonderful. Looks like lots of different ages. Glad to hear that. All right. Sometimes I press the forward button and it works, and other times it doesn't. All right, so why is it difficult to identify anxiety in childhood? Sometimes children just don't tell us what's going on internally. They suffer silently. It's not something you can see, it's not a broken leg that you can tell is going on. So with any kind of mental health concern, it does have to be something they tell us about, or maybe we notice in them. Sometimes families kind of downplay it, like, oh, just it's not a big deal, just get over it. And so children learn to withdraw or not share how they feel because they don't want to feel shamed or embarrassed. And then just any kind of problems like this that are a brain, I don't want to say brain disorder, but a way that our brain works that isn't helpful, sometimes we don't share. So don't feel bad if you weren't aware that your child was suffering with this. I know as a child, I had anxiety as well. And this is partly why I do trainings also, because I didn't know what it was. And I don't think my parents really knew what it was or how to help. So I think it's nice that we can start learning some of these things now. And this graphic here just shows a little bit about how our brains work. That if you can see the tiers, there's 3 different tiers here. There's fight or flight, there's freezing, and these are ways that we respond to our environment if we sense a threat around us. And what different people view as a threat can be very individual. So for one person, something may not feel threatening, and for another, it feels very threatening. So we do need to have compassion and understand that everyone sees the world and interprets it a little bit different. And at the bottom of that tier is that social engagement, which is that curiosity, openness, compassion, where children can actually learn. So if a child is right in the middle of an anxiety inducing event or a panic attack, they are not going to be able to reason effectively. That is not the time that they can learn how to do something different. It's actually when their sensory system is calm and they're not feeling a sense of fear that they can learn new strategies. So just wanted to kind of throw that out there. I once heard an analogy and I thought this was great. Someone was saying that when a child is having a tantrum, it's kind of like trying to reason with a child while they're having a tantrum is like teaching someone how to swim while they're drowning. So when you're drowning, you're feeling the world closing in on you and you're scared you're going to die. That's not the time for them to learn new strategies. So we need to wait until their system is calm. And at that point, we can start to learn some new strategies. All right, so these are some of the main disorders in children. I'm going to go through each one individually. Briefly, like I said, sorry, it's a little quick, but I want to make sure we get to the part of interventions that help. So the first one is separation anxiety disorder, which is an excessive worry of a child about a parent getting hurt or them getting hurt, which does often lead to school refusal. And this causes excessive distress when they're separated from their parent. Yes, children do love to be with their parents and sometimes they don't want to leave them, but this is really excessive. It could be, I know recently when there was, we have quite a few youth in Long Beach that if they have parents that are undocumented, we've had referrals from children that don't want to go to school because they're afraid when they come home, their parent may get deported. And that's a rational fear, but it is causing them not to really be successful in their school setting because they're so worried about what might happen. So that's an example of one type of disorder. We also have selective mutism, which is actually pretty rare, but I didn't want to leave it out. It's less than 1% of kids seen in mental health settings have this disorder. It usually happens before the age of 5. It can be a result of trauma, but it doesn't have to be. But this is basically when they consistently fail to speak in specific social situations, like at school. Maybe they're going to preschool and they never talk when they're at school. And it is causing some issues for the staff because they're wanting to get feedback, of course, on where that child is at developmentally and for learning and getting along with other children. So this does need to not just happen one time, but if it's happening for at least 1 month and it is causing problems at home or at school, then they can be looked into for that diagnosis. And then we have specific phobia. And this is where someone is really terrified of a specific object or situation. In the picture here, we have things like sharks. I know my daughter was terrified of sharks. There's spiders, dogs, snakes. Some of these, rightly so, right? Some of those things can harm you. So not all of that fear is unjustified, but this is actually a really extreme and irrational fear to where it is out of proportion to the actual danger that's posed by the situation. So the phobic object is actively avoided, or if they're near it, they have intense fear and anxiety. And then anytime, it doesn't even have to be, I know for my daughter, even just seeing a shark would create, she didn't have to be around one or be in the water, but just seeing one very briefly on TV caused a lot of fear that came up for her. So it definitely can be a specific situation. We also have social anxiety disorder, which is fear of being in social situations where they could be scrutinized or observed by others. They might avoid these situations because being in any kind of social situation always provokes that intense fear and anxiety. Things like crying, tantrums, freezing, clinging, shrinking, or failure to speak. And again, it's kind of out of proportion to the actual threat posed by the situation. So yes, we all get a little nervous when we're going into a new social situation. That's perfectly normal. That's our body responding to a new situation, but this is really intense fear. And then we have panic disorder, which is actually when someone has a panic attack. And just to review really quick, a panic attack is actually symptoms in our body it feels like your heart is racing, you feel like you can't breathe, you might feel dizzy, you might sweat, trembling, fear of losing control. A lot of people fear I'm going to go crazy and I'm never going to return from going crazy. And then often once you have a panic attack, you fear having another one, and that also causes more worry. So in order to have panic disorder, you do have to have symptoms for at least 1 month or more. So one time feeling nervous, it does not mean you have a panic disorder, but if it's happening pretty often and it's happening for at least a month, then that can be something to look into. And then this also can lead to agoraphobia, which is a fear or avoidance of situations or events associated with that panic. So for example, I went to a training on anxiety, and he gave an example of a client he had that she had a very severe panic attack in line at the grocery store. And she felt trapped because there was people in front of her and people behind her. And so once she sought treatment, then she also had to learn to not associate the grocery store with these panic attacks. So What happened was that she started to avoid going to the grocery store, or she would just go after hours, maybe at 10 p.m., where there was no line, where she would feel like she got trapped in line. So sometimes those panic disorders can also lead to other things associated with that, because that is so uncomfortable to have that feeling of that panic attack. I've heard also sometimes people feel like they're going to die, or they feel like they're having a heart attack. It kind of tricks our brain into thinking something worse is happening. Then the most common is generalized anxiety disorder. Some of you may see these symptoms and go, oh, okay, this sounds familiar. And adults also, there's a high percentage of adults with anxiety disorders. We've heard up to even 40% of adults may have anxiety disorders, but unfortunately don't get treatment. So it is good to seek out help for these conditions. We don't want you to suffer. So generalized anxiety disorder, in case you can't see the slide there, it's excessive and uncontrollable worry about school, grades, performance. It could be worries about the future, your family, your health, finances. It's worrying about anything and everything that could possibly happen. And one way that you'll know that you have this is these what if statements. What if this happens? What if that happens? And just constantly thinking about those types of thoughts. It also can have physical symptoms like headaches, stomach aches, just inability to unwind or relax. They might also have difficulty concentrating because they have such worried thoughts, always worrying about what's happening next. And then, of course, they're going to not be real willing to take risks, because anything that causes more anxiety, that isn't comfortable for them. So again, it's our amygdala in our brain, our fight or flight part of our brain, warning us what could happen. So, but once we're aware of it and we know that it's not our fault, it's just our brain doing what it's supposed to protect us, we can start to take steps towards, improving that. So generalized anxiety disorder can also have perfectionism, general fear of making mistakes, unrealistic or unfavorable assessment of their own abilities. So because they feel like they have to be perfect to avoid getting scrutinized by others or avoid something terrible happening, that can be very stressful for them. And then also if a disaster happens, they might feel like it's their fault. And then sometimes even if there's negative news happening out in the world, it might feel like it's going to happen to them. And then of course they may have sleep difficulties or irritability and fatigue. So if anyone has questions about that, feel free to enter those in the chat. As I said, we're doing kind of a quick review of the different diagnoses, and then we'll get to some more steps that you can help. So another one that I'm sure you guys have heard of is obsessive compulsive disorder, or OCD. We all like things, a certain way sometimes, but obsessive compulsive disorder is on a whole other level. So obsessions are actually the thoughts, and these are the thoughts that you're thinking that cause the anxiety. So a thought, for example, might be, I need to check the lock 3 times or it will not be locked. And so that's the thought. The compulsion is actually the behavior that you perform to try to suppress the thought. So the behavior would be, I check the lock 3 times. And then there's lots of types of compulsions. It could be washing your hands, needing to wash hands for 10 times or else they won't be clean. Of course, now with the pandemic, I'm sure we're all a little bit OCD with washing hands, and that's a good thing. Checking rituals. I need to check the stove to make sure it's unplugged because it might explode while I'm gone. Or maybe repeating a phrase a specific number of times. So this disorder also is treatable, but it is good to be aware. We did receive a referral from a school where, just for example, the student was always, and the mom was always running late to class. And so the counselor was kind enough, kind of talked to the mom and said, hey, just checking in. How are you guys doing? I noticed you've been late a few times, and is there anything I can do to help, and what's going on? And so the mom said, I don't know what it is, but my daughter has to take 3 showers every morning before school or she won't come. And so thankfully they were able to, get some help, and their daughter could get help with that. But I think for the mom, she, as much as she tried to tell her, you're fine, you don't have to do it 3 times. This can be something to be aware of. And there's other things that can cause those kinds of ritual behaviors, autism and things like that. So that's where you want to have a true diagnosis by a professional in the field. Another disorder is school refusal, where a child absolutely won't go to school there's various reasons for that. The Anxiety Disorder of America has a great toolkit there if you would like to look at that. Sorry, it's a little hard to read on the slide. And in the interest of time, I won't go through all of those, but we definitely can help youth that have this as well. We usually start with small steps. First, it might be, how about we just go to the front of the school, and then maybe we'll stay for half a day, and then we get to a full day. So we take incremental steps to help students with that. Then we have post-traumatic stress disorder. I'm sure you guys have heard of this one too, PTSD. A lot of different things can cause this, basically a traumatic event that is overwhelming for them. So it can be caused by physical or sexual abuse, any kind of violence, natural disasters. It could be an illness, a car crash, witnessing something traumatic. And then some of the symptoms, there's a lot of symptoms listed here, but you can have flashbacks, you might startle easily, you might replay the event in your mind over and over, or if they're young, they might replay the event through play or talking about it. They might also avoid people that remind them of the event. So, and then also feeling detached. So you're kind of withdrawing yourself from other people, an inability to have positive emotions because of that excessive state of fear. So for PTSD, symptoms do need to happen at least 1 month but it can also be many years later. We know people that have never treated their traumatic event from, say, they were in a war that happened when they were 20, but they're 60 and they still have not gotten treatment for this disorder, and it's still affecting them. So the good news is there is help, but we do need to not ignore when those symptoms are happening. So what can parents do and what can school staff do? I wish I could say we can take all the anxiety away. It probably won't 100%, but there's definitely things we can do to address it. So these next 2 slides, I'm giving a brief overview, and then I'll go into a little more detail on these. So the first part is reassure them that this disorder is treatable and that their symptoms can improve. I think sometimes children feel like there's nothing I can do about it. I just have to live with this, but let them know that we can get help for this. We want to listen empathetically. And what that means is understanding that everyone has their own experience. So just because us as parents aren't feeling that fear doesn't mean that it's not very real to your child. So we want to have compassion and understanding for them. Knowing that it's not all in their head, they're not making this up, they don't want to have this sense of fear, it's just happening without their control. So these symptoms are very real to the person that's going through them. So we do want to avoid being critical. I know it's hard, we get impatient sometimes, but if you can avoid doing those types of behaviors, it's going to help your child feel more comfortable to share what is happening for them. We want to try to provide that unconditional acceptance. This disorder is not their choice. They don't enjoy having that sense of fear. So we want to let them know that it's okay, I accept this, and I will be with you while we work through this. And I think as a parent, we only have control of ourselves. We can't control other people around us. So one thing that we can do is try to be that great role model of a positive life for your child. So when your child's going through something challenging, they are going to look to you as, what are the alternatives? How can I look to someone else to teach me how I need to act and how I need to be? The more calm and centered we are, then we can help our children. Of course, we're not perfect. We're going to make mistakes, but the more that we work on ourselves, our own self-care and stress management and managing our own mental health symptoms, it's going to help your child live a more healthy life. So, as I was sharing, I mean, depending on the age of your child, we want to problem solve together how to fix the problem. So, we never want to force anyone into therapy. We don't want to force someone to take steps that they're not ready for. So, sitting down together and talking about what the steps are to solve it together is a really great idea. And that conversation can look like, hey, I've noticed that you have a lot of intense fear when you see our neighbor's dog. Can you tell me a little more about that? So you want to face it with curiosity and try to not have judgment in something is right or wrong. When I say judgment, that means it's not right or wrong, it just is. And so when we have that unconditional acceptance of them, of exactly where they're at, then we can help them take those next steps. So have them describe for you what that feels like in their body. And that's going to help your child feel safe coming to you when they're having those uncomfortable feelings again. Giving them those positive statements, such as you can do this, I believe in you, you can overcome this, I can help you with this. It sometimes children don't feel like they can, and they need us to believe in them. And children believe what their adults tell them. They believe what their parents say. So if you do have a lot of power in helping them realize that they can get through this and they're going to be okay. So if you know that there's an upcoming fear-inducing event, it can be nice to maybe talk and practice it together a little bit, kind of ask them, what are the concerns that you have? Would you like to practice with me a little bit? Hey, this is uncomfortable, but we can get through this. You also can model some deep breathing techniques. There's lots of great YouTube videos on this, and it's not, I think it's helpful, instead of saying you need to do this, you can say, hey, you know what, I need to practice some deep breathing. Let's listen to this 2-minute deep breathing YouTube video really quick together. There's lots of great ones for children and adults. In the interest of time, I don't have time to go through all of them, but I think practicing together can be really great, right? Because we probably need those deep breathing techniques too. And deep breathing sounds so basic, but it's very life-changing when you do it, because if you think about it, our breath is our most valuable tool. Our breath is the very last thing we give up when we leave this planet. And when we take deep breaths instead of those short, shallow breaths that we normally do when we're stressed, it tells our brain to relax. It tells our circulation improves, we make better decisions, it calms our nervous system. So those deep breaths actually create that physical response that we need in order to calm down. So, and then also helping kids learn how to manage their emotions safely. I'm gonna have a slide on this in just a little bit to show you a little more how to do that. And then just having courage to seek treatment. They say only about 20% of people actually seek treatment that need the help. So we want to reduce the stigma with this. My goal is any kind of mental health condition should be viewed just the same as anything else. If you had a cold or you had diabetes or any kind of physical condition, there should be no stigma. This is a brain issue that you don't have control of, but there is help out there. All right, so I'm going to show a super short video talking about, as we were talking about stigma, and let me pull that up very quick. This, I think I need to share this again really quick. Let's see if we can, sorry, 1 second here. Sorry, see if we can get this. One more time here. Okay, can you see that video okay? Maybe give a thumbs up or a...
Hi, my name is Krishna Lewis, and I'm a senior at the University of Miami. I am a youth league presenter for NAMI on the Ending in Silence program. I have been diagnosed with post-traumatic stress disorder, depression, and anxiety. But today, I'll be talking about anxiety. So the one thing I wish that people knew about anxiety is that it's not something that someone can control. It's for me, it's the constant struggle with my mind every time to trying to control it, and I feel like that's something that affects me every day of my life. Especially with post-traumatic stress disorder and depression, my anxiety tends to get triggered due to my experience, and I feel like with having those thoughts and having those feelings of nervousness and fear, I feel like that's constantly a battle that I continue to struggle with. And when your mind overpowers your body and you have no control over it, it's really hard to be able to be the same person that you were the day before. Um, I'm not trying to be irritating. I'm not trying to be constantly annoyed. I'm not trying to have a panic attack. I feel like sharing my story is the reason why I decided to be a part of NAMI, because I want to end the silence and the stigma on mental health and show that it's not something to be ashamed of. I also feel like that sharing my story will impact someone to see that there is light at the end of the tunnel. The only thing is you just have to keep on walking. You can go at your own pace. You don't have to run. But if you take it step by step, you will be able to see that light. And I feel like it's important for people out there to know that just because you're stuck in a dark place, you don't have to be stuck in that dark place forever.
So NAMI is a great organization, National Alliance on Mental Illness. It's a really great one for educating people, and they have free support groups. So I encourage you to check out the NAMI website if you're interested in that. Okay, we'll go back to our PowerPoint here. All right, hopefully you guys can see that okay. So yes, as she shared in the video, you can have a successful, healthy, happy life with anxiety symptoms. So we want to give that message today that it doesn't mean, it may not 100% go away, but there is hope. So anxiety can also be healed through relationships. As a parent, as a calm, caring counselor or school administrator, you can try to be that calm center. The more that we are calm and we are what we call regulated in the mental health field, our fear isn't out of control, and we kind of learn to regulate our own fears, we can be that calm center. So our next slide talks about that a little more, how to do that. So a nice little tool that is really helpful to help children manage any kind of uncomfortable feelings that come up, it's called ROAR for the acronym. And you're not actually roaring, though if you want to, that sounds fun too. You'd probably feel pretty good if you roared. But the first step is to recognize, ooh, I'm having a certain feeling, an uncomfortable feeling, not sure what it is. Then we're going to observe that feeling without judgment. No feeling is right or wrong. It just is happening. I can't stop it sometimes, but what is this feeling? And often if you name the feeling, then it helps your brain to relax. Oh, I'm afraid because I'm going into a new situation and I'm not sure how it's going to turn out. That's okay. I'm not a bad person for feeling like this. And then we accept that feeling, which is number 3. This is uncomfortable, but it's okay. And just saying it out loud, acknowledging it, can help it to calm down. I think sometimes we feel like it's counterintuitive because we feel like if we talk about something that we don't want to happen, we're bringing it out into the light, but it's actually the opposite. Our feelings are supposed to come and go. We're supposed to allow them and then release them. So that's the final step there, is to acknowledge the fear and allow it to release when it's ready. So we're not pretending it doesn't exist, but we are releasing that. So that can be a really nice tool. You can even show it to your kids. Hey, when you're having that awkward feeling, it's okay, allow it, name it, accept it, and then you're going to release that feeling. So another great technique is from Peter Levine. He does a lot of work with victims of trauma. And what he does is help people learn calming tech, and we do this as therapists as well. We teach youth tools how to manage the anxiety. We can't always prevent it, but we can teach them coping skills. So when it does start to happen, they have some tools in their toolbox and what to do. So I'm actually going to show a quick video because he demonstrates this technique so much better than I do. There's two techniques he's showing in this video. So hopefully this is helpful for you. He does have a great website as well, where you can get the handout on this. I believe we do have it at the end. Let's see here, 1 second. I have to exit the other one really quick. All right, hopefully, can you all see that okay?
If we can give them even the smallest tools for
Thank you, Kimberly.
for self-regulation, and I mentioned a number of them. I demonstrated a number of these with a person, with a client. This is, I don't know if you can see this. Let me maybe move back a little bit, or something like that. Okay, I'm gonna get up on my haunches here. Here, you take your right hand and you put it here under your left arm, on the side of the heart. Yeah, got it. And the other hand on the shoulder. And just to get a feeling, Ruth and everybody else who's watching, what this feels like, what the sensation is like, not just of your hands, but of what's going on inside of your body. Most people report a settling. What this does, I believe, is it helps us become aware of our container. See, and we'll probably get into this a little bit more. The body is the container of all of our sensations and all of our feelings. It's all in the body. And this is the container of the body, is the kind of the outside of our body, our shoulders, the sides of our thorax and so forth. And when the person can feel the container, then the emotions and the sensations do not feel as overwhelming because they're being contained. Another very simple thing people can do, usually I suggest they do this one first. The second one is just putting a hand on their forehead and the other hand on their upper chest. And just to wait, they can do this with their eyes open or closed, whatever they feel more comfortable with. A lot of people like to do it with their eyes closed, or others don't feel safe in that. To just feel what goes on between the hands. Sometimes they'll feel like an energy flow or a change in temperature or a feeling. And I just ask them just to keep their hands there. It could be just a few moments. It could be 5 or 10 minutes until they feel some kind of a shift. And then to take the upper hand here, keep the lower hand on the chest, and then put this hand on the belly. And again, just wait until there's some shift, till there's some flow. And sometimes people, if they're unable to sleep or they're afraid they're going to have nightmares, if they do simple things like that, they fall into sleep much better, and often the dreams are much more useful dreams. There are other techniques.
Okay, I'll stop it there, but that available is on YouTube, or that video is available on YouTube. So he has a lot of great techniques as well, that are nice, tangible tools that we can all use at any time to kind of calm our nervous system. I know for myself, I sometimes use that before a presentation, like today. I'll kind of put my hand on my chest and one on my forehead and just noticing without judgment, nothing's right or wrong, what's going on. It can be, ooh, my heart's racing a little bit. I'm noticing my hand is warm, but my forehead might be cool. and even describing, if that's helpful, what's happening. And it can be a nice soothing tool that anyone can use. So I wanted to mention in therapy, we call it cognitive behavioral therapy. There's actually a correlation, and there's a triangle here of our thoughts, our feelings, and our behavior, how they're all intertwined. So there's a picture here of a dog, and this dog is running towards you. And depending on what thoughts you might have about the dog, that will create perhaps the feelings. So if you think that dog is going to bite you, what type of feeling might that evoke? It might evoke fear. It might evoke, not sure what to do, scared. The behavior might be that you run away or you avoid the dog. Now, if you have a thought that, oh, I can't wait to pet the dog, it's very cute, it looks really friendly, what kinds of feelings might that bring up in you? Perhaps that will bring happiness, excitement. And then what kind of behavior would that bring? Perhaps you will stay put, you won't run away, or maybe you'll greet the dog. So that's an example of, in therapy, we look at what are the thoughts that might be causing certain types of feelings that you have and behaviors. And again, we can't really control the thoughts. That's just our brain doing what it does. It generates thousands of thoughts per hour. Not all of these thoughts are helpful. So we identify what are helpful thoughts, and then that can help us to determine the feelings and behaviors. So I won't go into that too much, but it is helpful to identify thoughts sometimes, because that also can impact other parts of our behavior and feelings. Another nice tool is having some type of visual imagery. So because our brains are so amazing and they can do great things, they actually can imagine us somewhere different than we are right now. I mean, that beach looks beautiful. I wouldn't mind being there right now. But one thing you can do is have your child identify an image of a calm, safe, happy place. And for everyone, that could be different. For some, it could be a beach, it might be a forest, it might be, whatever feels safe and calm to them. And then you ask them to describe this place. What does it look like? What does it smell like there? What colors do you see around you? And it really can help them to, while they're doing that, to take some deep breaths, start to relax, and use our imaginations to our advantage. And when we're in that happy place and in that place where we're taking some deep breaths and we're calm and relaxed, that can be a really helpful tool. So often we use this in therapy as well. We try to have our clients identify what is a safe place for them. And another tool we use is, unfortunately, some situations we have to actually face the fear. So we can't avoid something that causes fear. So an example that I gave earlier of, a shark, we probably won't see sharks very often. So it's not important that we learn how to be around sharks a lot, unless you had a job in that field or something. But for naturally, what we tend to do when we have a sense of fear is to run away. And that's okay, that's normal. But what we have to do actually with exposure therapy is to face the fear and teach our brains that we're okay in those situations. And we do this by small, intermittent, gradual exposure to a stimulus. So I have the example here of a wave. Now that's a pretty big wave. I'd probably be afraid to go in a wave that big. But this book, I have it at the end. I can show you a little more, but this book is called The Worry Trick. I don't know if you can see it here. The lighting is a little weird, but it's by David Carbonell. And he gives this example of, naturally we want to run from something that feels scary to us. But if we actually face the fear and we decide that, yes, it's uncomfortable, but I can move forward, then we will learn to feel more confident and we can address those fears. So he doesn't recommend avoiding the situation. So the example of the wave is, when we see a big wave coming, we naturally think, oh crap, there's a big wave coming. I better start booking it towards the shore and get out of here. But what happens when we do that often is the wave hits us even harder, and it might knock us down because we've ran away from the wave, versus if you actually just dive under the wave inside, it generally won't hurt you. And if we can view our anxiety that way, that we still need, that we acknowledge, yes, this is a little scary and uncomfortable, but I'm going to go ahead and dive in and face the fear, we will start to build that confidence. And we do this in, like I said, small, manageable steps. We don't want to overwhelm someone, but with small steps, we can take those next steps. All right, so in the interest of time, we may go a little longer than the hour, just letting you know. But I do want to get through a few more of these. Another one is thought challenging. This is, again, challenging those what if thoughts. But what if this happens? What if that happens? David Carbonell in his book talks about you can notice that thought, and how about take a tic tac out every time you have a fear thought. Oh, there it is again. I'm counting my fear thoughts today. It's okay. And you might notice the more that you're aware of it, you can start to reduce that. So, wow, today I had 20 fear thoughts. That's okay. My brain's doing its job to try to protect me. Thank you, brain, for doing that. But you can learn to accept it without judgment. So that can be a nice little fun tool. He also recommends you could have maybe every day you have a designated time that you worry. If this is something you do a lot and you're trying to stop it and you don't like it, if you tell yourself for 5 minutes, I'm going to worry about everything I need to, it can be a nice little tool for, you know what, it's not my worry time. I'm going to take that designated time. So you can't stop your thoughts. They naturally happen without your control, but you can gently be aware of them. So in therapy, we try to replace them with more realistic thoughts. So maybe you're scared of heights, and when you get up there, you're thinking, I'm going to fall. So you want to replace that fear thought with something more helpful, like it's okay to be afraid of heights because I want to be safe. Right now, I'm safe and all is well. I love all is well. I say that one quite a bit. I am safe, all is well. And that can be a nice comforting thought to someone because they're thinking more fearful thoughts. So if in therapy, we look at, are these anxiety symptoms causing impairments in their everyday life? Like if they're not able to really function in school or at home, it's really causing a lot of distress for them. There's lots of different types of help. We have cognitive behavioral therapy, like we talked about, interpersonal, group therapy, family therapy. We also there are medications for adults and children, and then some complementary approaches that we'll talk about here in just a second. I did want to mention this study. This was actually done in 2008, where they did study children with anxiety. And in this study, they actually had almost 500 children and adolescents with different types of disorders, anxiety disorders, and they had them in 4 control groups. One group just had therapy, one group had medication, one group had therapy and medication, and then the 4th group had a placebo. So what they found in this study was that over 80% of children who received combined therapy and medication did improve, as opposed to 60% receiving therapy only and 55% improved that received medication only. But all of those treatments were statistically more effective than the placebo, which led to only 24% improvement. So I'm not recommending anxiety. I'm not recommending, that people should have medication or not, but I did want to bring up that study because I think it is interesting to look at some of the research that's been done. These are some of the medications that children and teens with anxiety might take. I won't go through all of those in the interest of time, but we have Xanax or alprazolam, benzodiazepines. Zoloft has been shown to have some of the best safety data in children and adolescents. So, and some of these are FDA approved for things like obsessive compulsive disorder and things like that. Again, that would need to be the conversation you have with your doctor, pediatrician, or child psychiatrist. So that would need to be done. That would be a decision between you and your medical provider. There's also some great complementary approaches, like yoga is wonderful for helping calm the nervous system, meditation, your own faith practice, and mindfulness, which is staying present in the moment, that yes, I'm noticing my fears for the future, but right now, right today, in this moment, I'm safe. We also have other things like acupuncture, herbal supplements, special diets can definitely influence how someone feels and their mood. There also can be different kinds of supplements like magnesium, calcium, different things that can help with anxiety symptoms. So, and these also can be used you can use those with therapy and also other methods. Some of the helpful resources for children and teens is the Anxiety Disorder of America. They have some great tools there. The website worrywisekids.org. There's the Child Anxiety Network, the American Academy of Child and Adolescent Psychiatry, some different fact sheets that are helpful. The David Carbonell book, as I mentioned, The Worry Trick. And then he has a great website called theanxietycoach.com. And I went to one of his 8-hour trainings, and he's been treating anxiety for over 40 years, and he's wonderful. He kind of has a funny approach of how we can, even his book says, how your brain tricks you into expecting the worst and what you can do about it. So it has a lot of great practical tools on there. And then, of course, where I work at ChildNet, we provide evidence-based practice therapy for youth. As I was sharing in the beginning, in case you came on later, we help youth with counseling services. And this is our referral phone number, 562-490-7600. And we do, our services are free, but the child does have to have Medi-Cal insurance. So thank you so much for being here today. I really appreciate your time. And I believe that Will is going to put our survey in the chat box. If you wouldn't mind filling that out, that would be wonderful. It's a very brief, I think it's only like 4 questions. And that is helpful for us as a Department of Mental Health contracted provider to find out if these types of trainings are helpful for all of you. And I'll stay on for a couple moments to see what people have written in the chat box and hear your questions. So thank you so much, everybody, for coming.